right, guys, how you doing out there? You know, I'm with my main man today, Dr. Jose Luis Flores. And guys, you know, before I get going, I don't want to get too emotional. Dr. Flores is a gentleman, and a lot of people out there, Doctor, I'm saying it personally, man, for the public. Dr. Flores helped a lot of people, man. A lot of people. Sometimes, you know, at the detriment of himself. I'm not going to go too deep into nothing. But yeah, Doc, man, I just want to tell you personally, man, thank you. And we got a lot of people out there, man, from Virgil Furley to me. Somebody's out there listening right now, you guys know. Dr. Flores helped a lot of people. And I never even heard you ever mention it, never say nothing about it, but this the beauty about this show today. This the Doug Best Show. And me and Dr. Flores here to just tell you guys, he's a doctor. I'm a businessman, entrepreneur, hustler from the street. But you could go all the way to rock bottom. And some people might say, man, I hope you don't start talking that God stuff. But we're going to talk about that, about medicine. We're going to talk about entrepreneurship. We're going to talk about Obamacare, all those different things. This is Dr. Jose Flores and Dr. Jose Flores, Superman.
Yeah.
Take the show, man.
Yeah,
Talk
thank
to
you
the
for having
people.
me.
Always a pleasure.
Yeah, thank you for having me here, Mr. Best.
Oh, absolutely.
Yeah, I've talked to you for a while. We've known each other for quite some time.
Mm-hmm.
And thank you for those kind words. And I feel the same way about you. You know, we've known each other for some time and seen the difficulties that we shared together.
Right.
We've seen the community, some of the stuff that the community does that affects itself, and some of the things that we've seen as children and how it affected us.
Absolutely.
And then how we have come to a place where we want to change things to be more productive in society, and not only that, but for God also.
Absolutely.
And so I'm here to talk a little bit about my journey, a little bit of a journey. I find that sometimes when I'm talking to people, what people have known me in the past, I used to have a clinic down in the Tower District,
Right.
and a lot of people know me from there. And I didn't practice medicine for some time.
Right.
And then now I'm practicing medicine. People always ask me the story, you know, what happened to you? And then why are you now the way you are, a man of God?
Life.
Yes, life. And actually doing God's will rather than my will. But yeah, that's what I want to talk a little bit of testimony. I want to inform the public about things that you should know about, things that affect you, your health, what things, sometimes doctors don't communicate with you. There's a miscommunication, so I want to talk about things that the audience should know about certain aspects of diabetes, blood pressure, how they should be taking their medicines, some of their insurance issues that they're having, just a little bit of enlightenment for them.
Yeah, Doc. I was just looking out there just to see if we had some people just chiming in. We hope, man, out of all the podcasts I did a lot. This podcast today, I feel it the deepest because oftentimes I hear a lot of people says, man, I just want to get a whole bunch of money. Money's beautiful. But then I know some people, relatives in Mexico that's got a lot of money. I won't talk about too much about my senorita's business. But there's some people in her family with a whole bunch of money, but they sick, health-wise. And they always tell me how important health is. Douglas, this is what they tell me. Make sure you take care of yourself. Mm-hmm. And so the people out there today, we see the Obamacare, Affordable Care Act, and we see the President Trump, and they keep fighting in Congress. And then I wanted Dr. Flores to get on here and break it down. What do all that mean? How do it affect us? If I got CalViva, if I got Blue Cross or Blue Shields, how do that affect me? Yeah, Doc, those are the kind of questions that, I think the people gonna want some questions, some answers to. Can you handle that?
Yeah.
Talk to me, baby.
Yeah,
Let me know then. Okay.
Yeah, so we can talk about that. So the thing is, the Affordable Care Act, we all are familiar with it. It's something that was brought on to help people of specifically a lower income community, people that are underserved. There are some restrictions that are placed on the healthcare companies, mainly the insurances. And the Affordable Care Act was made with specific details. It's very broken down as to limitations and what companies can charge, what companies can do and not do as far as helping out their clients or their customers. But at the end of it, insurance companies are steal the people. They rob the people. They we know about all these big executives making a lot of money, and the money they're making is actually less money for the patients, and they're paying less and less. And I see it in the clinic. I see in the clinic every year it appears that insurances are paying for less tests that are necessary. They don't want to do MRIs on people's heads who've had strokes. It's necessary. They're just denying them. They're not paying for them, and really for no apparent reason. The other thing is medications that people used to get. All of a sudden, doctor, my insurance is not paying for this medication starting next January, and so they're stuck. And so, what does this all mean? So right now we're in a place where the Affordable Care Act is going to come to an end. And what that means is a lot of these guidelines and restrictions that were placed on insurance companies are going to be no longer in effect. They're going to be unrestricted. So that means that they can increase premiums and make it difficult for people to get insurance. Now, the other side is proposing giving you a FSA, which is like a type of savings to help you offset some of your copays. It's very limited. It's $1,000 to $1,500 per person per year. That would only help pay certain things. I mean, if your MRI, your copay is $1,000, there goes all your money, but they don't have a backup plan. So what I'm trying to say is right now there's a lot of discussion, and basically there's going to be a lot of changes to healthcare. The Democrats have a plan that's in place. The Republicans just have a tentative plan. So what we want to do is to be well informed of what's going on. How is it going to affect your insurance? What it's coming down to is they're paying less for your services and they're charging you more. Mm-hmm. So now I'm seeing people with Medicare, they're having to pay $47, $50 for a medication they didn't have to pay for before. And these are people that are on fixed incomes. So this is making it very difficult for them. And it's very concerning. On top of that, they are paying the doctors less. They're paying the doctors less, and so the doctors are not willing to see people with Medi-Cal, with Medicare. They're not willing to see them anymore because they're cutting the payments that they're getting already, which is very minimal, even less. For example, if they're getting $70 per visit, now it's being cut to $30.
Yeah, Dr. Flores, just bear with me just one second right here. We with you, but we done had a few people out there. I had a gentleman in here yesterday, Sammy, and he was making some adjustments to the podcast, and even though in our headphones we could hear this real loud, but everybody's saying it was too low out there. I see you out there, Tay. I seen you, and then I see Smack back. It says Smack and Ray Chapman, and then I see Dr. Flores. Vet, and I see my senorita says that it's too low. We got it now. You guys tell me how we looking out there now. Dr. Flores got the flow. We just going. I got the microphone straight on him. I just want to make sure that we got everything out there. And guys, I love you for that. That's what this show is about. Let's bring it here. Just what the show is all about. If you got a question about something, anything about medicine, Dr. Flores is the person that you can ask right now. And this is what the Doug Best Show is all about. This ain't about no money at all. Dr. Flores ain't trying to make no money. He got to practice. And you guys know how much money doctors make. I'm not trying to do no money here. This is for a voice for us. Okay, Dr. Flores, go, and I'm going to bring it back. How you guys out there? Is the voice, is everything okay? Keith Russell.
Keith Russell's okay.
Yeah. Doc.
I remember Keith, yeah.
Yeah, so right here, you can't see what the people saying, but I can see it. And then I'm just going to chime in from time to time and just say something. But Dr. Flores, go back. He talking about the Affordable Care Act. If you guys got any questions about anything, kidneys, liver, high blood pressure, sugar diabetes, strokes, anything, Dr. Flores is going to answer for you. Go ahead, Doc. My apologies, guys. Y'all keep rolling, baby.
No, so Yeah, so we briefly talked about policies that are changing right now and things that are going to happen. But what does that mean for the public? What does it mean for you? I want you to be more involved. When something happens with your policies, with your insurance, be active. Call them. There's a number in the back. I say, no, no, I didn't ask you to change my insurance carrier. I didn't. When something happens, they're not paying for your meds. You have the right to call them back and fight it and tell them no, because a lot of patients are coming back and doc, they're not paying for this medicine. They used to pay for this one, and these are medicines that are vital for their health. You know, whether it be for stroke or diabetes or blood pressure. We all know that blood pressure is a big problem, and it causes strokes. My father had a stroke, two of them, and it left him pretty debilitated. And this is a very strong, active man who worked in the fields all his life. And I sad to see him now move slowly. And why? Because, you know, two things. One, his diet wasn't the way it should be. So diet is a big thing. And there's ways to keep our cultural food, but also keep it healthy. And then the other thing is medications. Take your medications. That's the best advice I can give you. Take your medication because it is crucial for prevention. Once a problem is done, then it's a little too late. But yeah, you know, whatever questions you guys have in regards to things, I'm going to overview a little bit on blood pressure, a little bit on diabetes, and a little bit on cancer, and then we'll go from there.
Yeah, Doc. So just, hey, guys, thanks. And, hey, Dante, man, I love you for that. Man, if you guys see me doing anything wrong, tell me. Don't be feeling like you bugging me or nothing like that. That's what we trying to work out all the bugs. And so when anything happen, we got a voice. Yeah, Doc, we got a couple of people right here. Fresno native says, could you talk just briefly about, and I'm gonna go up the list. I see a lot of people got questions. The Fresno native says, could you explain how the physical health affects the mental health?
Absolutely, yeah.
Dr. Jose Flores, everybody, on the Doug Best Show.
Yes, absolutely. So that's a great question. So mental health is a powerful tool and movement for your health. If someone is physically healthy, meaning there's nothing wrong with them, but they suddenly become affected mentally, somebody dies in the family, they go bankrupt, whatever, they can physically have hypertension. They can develop hyperglycemia, which is high sugar. They can develop atherosclerosis. They can have a heart attack or stroke. So this is someone who's physically fit, no problems, with a mental, shock or a mental health catastrophe. They can go from 1 month to the other to going really sick. People say don't get angry because it's going to give you a heart attack. Absolutely true. The temporary rise in corticosteroids or cortisol, as we call it, is a stress hormone, causes the arteries to be plugged up and they get a little bit more, the blood gets thicker, blood pressure goes up, you get a heart attack and stroke. Vice versa. If people are really sick and they physically have a lot of problems, it can really bring down their mind. It can really bring down their mental health. Their spirit can be kind of broken. And this is kind of my area where I go into faith. We're raised, I always tell people this, I said, you all know one person in your family. It's usually a mom, but it's usually a female figure teaching you all about God. When you can't do life anymore, pray, get on your knees. I find the strongest factor for people living healthy is their faith. And then with that follows the mental health. So you have to do something for your mind. Read, have fun, like Mr. Best does. Laugh once in a while, be happy, smile, those type of things. You gotta enjoy your life. There's struggles with it, but very closely related.
Right. And we got okay, so let's go. Fresno native says, thank you, Dr. Flores. I really appreciate that. And then Smack says, could you tell us a little bit more about what really causes heart attacks with people?
Sure. Yeah. So the number one reason or the one risk factor for heart attacks is smoking. Smoking is the number one. It's what we call a lifestyle factor that we can change. So this is something we can change. So smoking is one of the highest risk factors. Then comes, of course, diabetes, high blood pressure, family history. Even males, we tend to have more heart attacks males do than females. Right. Females live a little bit longer than we do, but they also have to go through all the pains of labor. I thank God for that because I wouldn't want to go through that. But these are some of the things that cause it. And then, of course, lifestyle changes. If you're not trying to get some kind of exercise, you're not trying to stretch out, you're not trying to watch your diet, your body will tell you what you need to stop. For example, for me, I love bread. I love, pan dulce. I love chicharrones. I love all that. But after I eat it, now that I'm a little bit older, my body don't feel
You
good.
ain't that old, dog.
I feel older, and the body just doesn't take it anymore. Not like when I was in college. So what you do with your body and how you take care of yourself has a lot to do with the heart attacks.
Beautiful. So anybody else got anything out there? Somebody, I was on my main man. I don't know if I got to say this correct. My main man, Zeb White. Doc, could you explain to us just a little bit prostate cancer? Why it affects black people more, black men more? Prostate cancer.
Yes, there's a huge disproportionate number of Afro American men. I believe it's about 5 times the rate of Caucasians. Well, it's always compared to Caucasians because it's a majority population.
So what we doing? What is it? Anything specifically we doing wrong, or we like the sex a little too much? I don't know what.
It could be. It could be a little bit of that. It could be just genetics. There's some studies that show there's some genetic predisposition with the Afro American population as far as prostate cancer is highly associated with what we call markers. And markers are genetically predisposed, and so it means that it's either carried on by race or by family, by a certain individual. And so Afro Americans have certain genes that predispose them. So what does that mean? It means that you have to take more care of yourself. It means that you shouldn't be smoking. Smoking is the biggest.
This is
factor.
somebody else just asked about that. He says, "What about smoking? Marijuana? That's smack."
That's a great question. I just had a patient come in, and she told me that she looked pretty sad, and I said, well, "What's going on with?" Just stressing over my son. I said, "What happened to your son?" Well, he just got diagnosed with cancer, and he says, "But he doesn't smoke cigarettes. He does smoke the other stuff, and he's only 58." And so.
But it's legal now, so how can it be bad?
Yeah, it's legal now. But the problem is our lungs are not meant to have anything artificial inside of them. So only the air that God gives us. If anything produces any type of smoke, whether it's from a car, from food we cook, from anything that produces smoke, it's toxic to the lungs because it puts particles in the lungs where they should be nice and clean, where the air can exchange to the blood vessels. But anything that goes there, COVID does that. COVID comes in and puts a little plaster, and that's why people are having these problems with their lungs. So whenever you smoke anything, it doesn't matter if it's marijuana or if it's vaping, it's going to cause some lung problems. So I tell people, if you're going to do that, if it helps you, okay, that's your deal. But why don't you take some edibles rather than do that? I don't promote it, but if you have a choice, I would tell you to take edibles versus smoking.
Okay. And then what was the other question out there? Somebody, Fresno native wanted to say something about the proteins, the balance of proteins and carb balance. I don't know if I'm just reading it how we say it.
Yeah. So that's a very big thing, and understandably so. Nowadays, with the women, they're very health fit and focused. We see a lot of surgeries out there that women are having. I don't. If it makes them feel better, if it helps their mental health, I don't have any problem with that. Just do it safely. But as far as protein, ladies, men probably know more. You need protein to maintain your body mass.
So you're saying meat, beans?
Anything that has protein, whether it's vegetable derived or animal derived, even the protein supplements are fantastic. But you have to maintain it's 1 gram per kilogram, which what that means is, kilogram has 2.2 pounds. So if you're like, say, 180 pounds, that comes up to about 80 kilograms, 90 kilograms, and that means about 80 or 90 grams of protein a day. One of those little scoops has about 30. So you kind of figure it out. So you want to have a balanced
How many
protein.
steaks is that? 2 steaks, 3 steaks?
About a good size 2-pound steak will give you the 80 grams.
Oh, I can handle that. I can handle that.
Yeah. So, and carbs. So you want to eat complex carbs. Those are the oatmeals, the sweet potato, not the stuff that comes in a bag. Everything that comes in a bag, those are bad carbs. Anything that's fried is bad carbs. You want to balance it. You need them, but you want to balance everything out.
I can see that. And guys out there, my main lady, Sandra Yates, Beverly Smith, where you guys at out there, man? If somebody, you got a family member out there that's got a question, and you don't have to go to the doctor right now. This is what the Doug Best Show is, and Dr. Flores, I love you for coming on in. And
Of course, it's my
and
privilege.
we got some Spanish speaking people out there. If you want to talk to us in Spanish, my Spanish is más o menos.
Pero también hablo yo el español bien.
Oh, okay. Háblame, baby. Now, Dr. Flores could do it all. He could speak the language of Donald Trump, the people, and then he could speak the language of the streets. And then, by nature, DNA, he can speak Spanish. Anybody else got any questions out there, Doc? Yeah, Doc. So just touch on if you can. I know we got some Christians out there, or some Jewish people, or whoever it is. Just touch on, how it's sometimes, we black people. Nah, I shouldn't say it like that. People from the street. Sometimes somebody told me one day that, hey man, you did that, not God. How can you draw the spirituality into health and living well and giving God his just, but then yet you being who you are, if I articulated that right. I could still be Doug from the mud, but still I could just say, man, I know it's a God.
Yeah, so the biggest thing is, we all go through challenges in life. We all go through challenges in life. No one has a harder life than other people. We all have specific challenges. But like I said, someone in our lives told us about God and to trust him. And it's usually the person that we respect the most, that we love the most, and for some reason it was the sweetest, but also the one you don't want to cross because she's very firm. That was my mom. But, what I learned from her when she went through her cancer and everything is how faithful she remained. Even in her dying last minutes when she was suffering a lot from pain, she still glorified God. And that amazed me, that kind of peace. She was peaceful. And I never knew peace until I started getting closer to God.
Right.
Once I accepted Christ into my life, that was probably about a good 11 years ago. It's been a good 11 years since I last. Some of you may know me from the past. I used to like to drink a little bit too much. I used to like to have fun a little bit too much. Wasn't following God's way very much. And then, I don't mind saying to the public, I got to a point where I had to give up my license to go to treatment, to accept Christ. And it was the biggest blessing I ever had. And now I feel that God has given me everything back because I'm deserving of it. I heard him talk to me once. He said, well, how does God talk to you? We know when God talks to us. You can hear that voice, And I remember him telling me, you were working for you before, now you're working for me, so I'm going to reestablish you. And so the type of medicine that I do now focuses more on the spirituality. Like I like to listen to people. Doctors are just in and out real quick. I like to listen to people. I want to hear their problems. I want to get to their soul, their spirit, so that I know that that's doing well, because I know that once that is well, the rest of the body will heal.
Is that holistic? When I was studying today, I kept running across that word, holistic.
Holistic, yes. It's called holistic care of the patient, meaning taking care of every aspect. It's not just the physical, it's not just the mental. Don't forget about the spiritual. So for those who don't believe in God, who are saying, well, that's okay. Mindfulness, meditation, doing things for others, doing volunteer work. We all have done some kind of volunteer work or help somebody, help some lady cross the street, help somebody pick up something. It feels good. It feels really good to help people.
Yeah, Doc. So this Fresno native says, do liquid IV serve the purpose? Let me just read it real fast. I don't know what liquid IV is. I thought he was talking alcohol, but it's not. He says, does liquid IV serve the same purpose as regular medicine? Is it just up for sale? If that's what I'm reading.
That's a good question. I tell my patients to buy liquid IV when they're sick?
What is liquid IV?
So liquid IV is essentially, some people came up with a very smart idea. They put electrolytes into a powder form along with some minerals, potassium, sodium, chloride, magnesium. Your body needs these things when you're sick because they help with protection from viruses, from infections. The first thing, as an ER doctor, the first thing we do is put an IV in people. It's just sodium chloride, which is just salt water. But you'd be amazed how many people get better just with one bag of IV. All that's it. That's all you give them, and they get better. We're made out of water. We're 98% water.
That much?
We can 98%. We're if you were to take the molecular structures that we are, you would see that the water compound in our body composition is about 90%. We basically will be nothing but dust without the water, you know? And so muscle is heavily with water. Everything. That's why MRI uses the protons inside the water molecule to actually give imaging. And because we have so much of it, it gives us a really detailed picture of us. And so someone that doesn't drink water for 3 days is getting close to a life-threatening condition. That's how bad we need it.
Right.
So
right.
electrolytes are crucial. I would say 70, 80% people, one bag of IV gets them better.
Yeah, that's great. Yeah, Doc, you guys on the Doug Bass Show with Dr. Jose Luis Flores. If you guys got a question out there, this is your opportunity. Oftentimes, you know, when you go to the doctor, you stay in the room for 3 to 5 minutes. And I studied it. And they usually make between $300 and $500. Some, you know, depending on whether they're a specialist or not, something like that, they make a lot of money. I went to the eye doctor, and Dr. Poston, oh man, God, he's the best. He stays in there, you know, as long as it takes for you to walk up out there and know what you're doing. Yeah, Doc. So when you see a patient, is it, am I just being thinking like that? Man, this is for the money. Or do you guys got a certain schedule? I got 15 people I got to see in 1 hour, and I got to make that 5,000 in 1 hour. Or do you stay in there as long as it's necessary?
Yeah, it's a good question. So society now, insurances are paying less and less. So docs are kind of moving and moving. A lot of these big companies like Omni Health, and I'm just going to say the name because they're federally qualified clinics. They get paid government money to see all.
Do you get
patients.
less money from the government, or if I just came in there and said, "Hey, man, I don't care how much it costs, I want to see you." Which one you get the most money from? The physician, the doctor.
Yeah, so the physician will get more money if they're affiliated with one of those clinics because they get federal money. If they're in a private clinic like I am, which is a rural clinic, it's a little bit harder for them. But the insurances are paying so much less now that the doctors are finding themselves having to see 3 to 4 patients an hour, 5 patients an hour. Before it used to be 1 or 2. You give patients more time.
Right.
If a doctor has more like a cash paying clinic, or if they have a private paying clinic, they have a little bit more time to spend with them. But unfortunately, docs are hurry, hurry, hurry. They've forgotten their bedside manners. That's why you don't see docs visiting patients in their homes anymore. It's not profitable for them. They don't pay enough. Insurances won't pay for that. And it takes a lot of time. Well, back in the days, you know, people used to get reimbursed by however the patient reimbursed them, and it was rewarding for the doctor as well as the patient.
Yeah, Doc, I'm going to take it back over here with the two of us. So this is the question, and I think if somebody's else out there, man, just see if I'm asking him the proper question. Man, what is, I think I know the reason. It's $5 trillion. I don't even know what $1 trillion is. I know what $1 million is.
Yeah.
10 million. I know what that is. But $1 trillion. So just explain to us, what is the big fight with the President Donald Trump and Obamacare? Is it money? Because I know when I went to Mexico, man, I gave the guy like $100 and pesos, but he was only charging me like $40. I said, man, my senorita says, he didn't want that much. Give him that money. So you could get better care. That's true. I got sick in Mexico and they fixed me. Better care, cheaper in Mexico, but technology is better in America. What's the fight all about with the Obamacare?
Yeah, it's a good question. It's kind of hard to, how should I say it? There's no evidence that it's about money, but that's kind of where
$5 trillion is money.
Yeah, but there, you know, where's the money going to? You know, everybody's pointing fingers. But what is clear is that the insurance companies are getting a lot of money, and insurance companies have a lot of say so on politics. In this country, we try to run things right, but there's also these influences that are supposed to be against the law, but we know they still exist. if you do this, I do this. So I think there's a little bit of that because people that have money don't really worry about the cost of healthcare. They have the money. They can get best docs. You know what? They have something called concierge. I can't say that word sometimes, but concierge. So that means that the doc gives you one-on-one attention, but you pay him cash. So you pay the doc $5,000 a year, and he will take your calls. He'll see you whenever you need to be seen. You don't need to wait in office. You don't need to do nothing. But that's what you can pay for. People that don't have money go with Medi-Cal or Medicare, but they don't have that kind of attention. So it's definitely about money. Everything is about money, but appropriation of these funds, that's the question, is who's moving what into what direction?
Yeah, so with the Affordable Care Act, it's Obamacare. Can we just call it Obamacare? So right now, what's the fight about? They talking about extending the coverage of the premiums. What exactly is that all about?
Yeah, so the Affordable Care Act provided for something called subsidies. Subsidies is something that the government will pay the insurance companies so that they don't charge too much of a premium to the buyer. So it's to offset. So say without the subsidies, the insurance company would charge you. So I did a little thing on Obamacare. I went onto the website and I did a thing, 2 people at $36,000 a year. What would it cost? So the very basic, it came out to HMO Kaiser, which is one of the lowest one, came out to $200. PPO came up to like almost $250, but it had a $1,500 deductible, meaning you have to pay out of your pocket $1,500. That means no medicines can be paid, no doctor visits can be paid until you paid $1,500, and then it'll start kicking in. So if you don't go to the doctors that much, you're paying what 200 times 10. You're paying almost $2,500 a year for nothing. Mm-hmm. Now, if you drop to the next level, which means you don't have no deductible, it means it covers right away. Those 2 levels, the HMO goes up to $550 a month, and the other one goes to $1,200 a month. How is someone with a $36,000 a month a year income going to be able to afford that? And that's just it. So what Trump is saying is, I'm going to give you this little card that's going to give you the $1,500 so you can pay that off, but it doesn't do anything for the cost of the insurances. It's not doing much for that.
Right.
It's just going to give them a little bit of money to offset that. It sounds good, but it's not really helping the insurance companies control how much they're going to charge you.
Right.
Whereas the Affordable Care Act has laws in place to keep them from increasing the charges. So there's the thing. So it sounds good that he gives you this money, but there's really no control over the what do you call it, the laws that affect insurance companies from keeping them from abusing you.
Yeah. So Doc, just in Mexico, I talk about Mexico. So I've been going to Mexico for the last 10, 15 years with my senorita. So I see the price of medicine over there is so cheap. But how is it possible with America? If anybody else out there thinking the same thing, I don't know if a lot of people that travel and paid attention. You could buy one. Just use Viagra for example. I'm just using it for an example. The blue pill, baby. Before I bought the pill before the pill would cost $45, $50. In Mexico, you can get the pill for 75 cents. Mm-hmm. How is that possible? How will I know that? I was just over there, I'm just looking around. I'm just checking the price. I'm just checking prices. How is that? Yeah. How is that possible that here in America that they could charge so much for medicine, not just insulin and the rest of the stuff?
And that's the thing about the United States. It's a wonderful country. There's opportunity, but there's also, because of that freedom, a lot of these companies, a lot of these individual, especially pharmaceutical companies, health insurance companies, they will just grossly overcharge for things they shouldn't. So, for example, when Viagra first came out, let's use another medication.
Oh, yeah. Don't be what? Yeah. My senorita says, what? Okay, I see you. Go ahead.
Yeah. So let's use another medication. So these new injectables for weight loss, right? So we have Ozempic and we have Mounjaro, diabetic medication, became very popular as a weight loss. It was being shuffled over for weight loss. They're not meant for that, but the companies made tons of money. But the problem became that because of some of these guidelines that are affecting these companies, that some of the ACA, the Affordable Care Act had put, they said you're running out of medicines for diabetics. You can't do that anymore. So they didn't allow anymore. But they saw a market there. So what they did is made the similar Manjaro and Zepbound. And so what these were sold same ingredients, sold for half of what the other ones were, and they were made for weight loss.
Mm-hmm.
Now, because it was such a popular thing, they ran out of these meds, and so the insurances weren't being covered. So then people got the idea, I'm going to make the generic. They made the generic. Well, these generics are running about $200 a month. The original medication is $5,000. Same medication. All it is a copyright. So it's just about money. They're just marking up the price 1,000% for money. In Mexico, they just want the business, and they're trying to just make a lot of business, lower prices. They get a lot of business.
Yeah, I agree with that too. But then one thing I just want to tell you guys, we was talking about Viagra earlier. But first, Viagra actually started out as a high blood pressure medicine.
Mm-hmm.
And listen, man, true story, because I researched it before I came on air. They got these old guys walking around in the nursing home, and you could just imagine the rest. The old guy walking around and went, oh my God, this hasn't worked in years. That's what the Viagra did.
Yeah.
Yeah, guys, we on the podcast on the Doug Best Show with my main man, Superman, Dr. Jose Flores. Anybody else got any questions out there? Yeah, Doc, what else you want to talk about? Talk to the people.
Yeah, so, one of the things that when I talk to my friend Doug here is, Mr. Best, is, that I wanted to let people know about how God works in your life. I no longer consider myself a doctor, but rather a man of God doing God's service as
Absolutely.
a physician. And so why is such a big fuss about it? Why so much? Well, one, I from being an alcoholic to becoming a man in recovery, now I was helping others with something that the devil was trying to kill me with. It was a very powerful thing. I went to treatment centers. I got medicines. I couldn't get better. But I finally accepted Christ at the Salvation Army. And
I was going to ask you about this. Some people, go ahead.
Yeah, Salvation Army, great program. Doesn't charge you. 6 months. I went in, came out just on fire. God rebuilt me again. And so I'm teaching a new generation of medical students. They rotate through my clinic. They see the way I practice, and they love it. They see how I connect with patients. This is what we're meant to be, is to connect with patients, to be patient, to listen. When a patient comes in and she's sad, or are you depressed? My husband just died a month ago. Okay, let me give you somebody. No, oh, I'm sorry to hear that, but talk to me about it. Let's take some time. But doc, you have a lot of patients. It's okay. My patients wait for me because they know I take the time for them. Mm-hmm. That's the difference in patient care. Right. And so that's a doctor that has God first, taking care and listening to them first, and rather being stressed. And everything works out for itself.
I agree with that, yeah, Doc. But I think that's just your normal personality. We got a young lady here. Her name Marlene Mack. She got a couple of questions. She says, Doc, when your lung is damaged, is there anything that you could take to keep it from getting pneumonia? I think I'm saying the word right.
Yeah, pneumonia.
Yeah, P-U-P-N-E, pneumonia, yeah.
So it depends. If your lung
Marlene Mack.
Yeah, so if Marlene, right?
Yeah.
Marlene, yeah. So if you're talking about lung damage like an emphysema, that's permanent lung damage. It means your lungs don't work the way they used to, as opposed to COPD, which is another form of lung disease. They come from either smoking or just chronic conditions. What it means is your lungs are no longer able to help themselves, to repair themselves. They don't protect you from all the elements of the air and infections. So what can you do? Avoid places where there's sick people. Take medications if you need medications for your lungs, like inhalers. And 3, get all your immunizations. Immunizations are key. Pneumonia and flu vaccines. And then, of course, if you're really debilitated, you should wear a mask.
Right. Thanks, Doc. We got another question here. I'm going to have to write it out for you. It's CHLOROPHYLL. It says, how vital is that?
Spell it again.
I'm about to write it out. Hold on 1 second. I got you right here, Fresno native. I got you. I'm going to have to write it out for the Doc. LOPH. If you guys got some questions out there, before the doc go, you guys.
Yes, whatever you want to answer or questions. So chlorophyll. So how important is chlorophyll for?
I don't need no chlorophyll.
Okay.
So,
Okay.
yeah, guys. So you got this. You saying, Doug? No, I don't know.
Okay.
I'm
So
learning as he goes.
They're asking me what the chlorophyll is used for. Or?
Says, let me find him again. He says, give me 1 second. He says, how vital is chlorophyll? I'm just going. I ain't getting everybody. I'm just going through.
Yeah. So chlorophyll is usually found in plants. Okay. But it's part of the plant that helps it build its own food. It helps it survive. Without chlorophyll, plants don't survive. It's a magnificent little. Sometimes it's called a cell. Sometimes it's called a little organelle that produces light into energy. But how is that effective for us? Well, for some studies have shown that chlorophyll is actually very powerful to fight infections and for immunity. So is it vital? No. But will it hurt you? No. But we all know that eating vegetables and stuff is very healthy for you. So I would say eat them.
Yeah. Miss Max says, she says, thank you. You used to be my doctor. You're a good doctor. And
thank you.
And handsome.
Thank you.
You know his wife in there. Stop it right now. Anybody else out there got some questions? We with Dr. Flores. And Dr. Flores went through that Salvation Army. That's the name
Salvation
of the program?
Army, yeah.
Yeah, the Salvation. He went through the program. And yeah, so Doc, so what happened, oftentimes we see a person in your position, a doctor. Mm-hmm. And then you just see me, just Joe Blow, living life. And sometimes, oftentimes, we thinking that people in positions like you're in, you don't go through the same things that the average person go through.
Right.
So when you speaking about God, people say, well, he's a doctor. They making $5, $4, $5, $3, $10,000 an hour. What are you talking about? He ain't got no problems. Is that true or false?
It's false. I mean, we
false. Wait a minute.
Well, the thing about the money, well, that's a little bit different. Everybody, depending on where you're working. I work in a rural clinic, so we serve the people more, so it's a little bit lower pace. But as far as what we go through, all of us. So this I like it how they say it with addiction and alcoholism. It knows no barriers. Doctors, lawyers, presidents, even priests, even pastors, children, adults. It just black, white, Asian. It has no barriers. So we, as doctors, believe this or not, I'll tell you this right now because it's something the public doesn't know. We have one of the highest rates of addiction and alcoholism and addiction. Doctors do.
They do?
Yeah, very high. Very high. And there's
Why? Because you guys jaded?
The stress. They say the stress. Yes. The stress has a lot to do with it. And then the other thing is one of the doctors that I work with, Dr. Batista, he says it very clearly. Well, you go from being in the streets or being somewhere where you're poor, and then all of a sudden you make money, especially a person of color. I'm just talking about me. You get a little bit big-headed with money, and then you're always kick in, and then you start, indulging. And so some of them have those hidden genes to become alcoholics, drug addicts, and so they go through that. So doctors have the same problem. So I do a lot of talks, and I speak to doctors about addiction, and I encourage them to come out, especially if they're in hiding. There's a lot of doctors that will not talk to each other about their problem. If you say anything like, "Oh, you had 2 drinks" or something, like you said, you get jaded. Like, "Oh, he's going to be one of those that pick up fingers on." Yeah.
Yeah, Doc. So this is beautiful right here. So the thing is, I think that you telling us, I'm gonna say it like this: it's a long time ago. I had a whole bunch of money. I was from the streets. I had a whole bunch, and then I got knocked down and went to prison and came out and had to make it all, make life all over again. Yeah. So Doc, so is you saying that even if the person went through an addiction and he's bouncing back from it, is it a negative or positive? Because we didn't went to the lowest low, and we coming back, and we sitting here talking to the people right now about real. This is what this show is all about, real life stuff. The Doc, it's like he don't have to be here to talk to us. He can hide in the closet and pretend like I never had another real life experiences. But you sharing, man, and it's touching somebody out there.
Yes. Yes. Here my verse is seek first the kingdom of God and his righteousness, and all things will be added upon you. God does not lie. So if you seek him first and you forget about your head, what you want, and then Proverbs 3:5-7 says, trust in the Lord with all your heart. Do not lean on your own understanding. In all your ways submit to him. And don't be wise in your own eyes. Shun evil, and then make your path straight. So what he means by that is when you forget about your ways and start trusting his ways, life becomes better. You don't get rich. It doesn't guarantee anything, but you will know peace. And that peace will be reflected in the person you are. And that will make you a better doctor, a better nurse, a better wife, a better husband, a better father. And that's the essence of life, is to be at peace and to show love that's given to you. Now, when we do that, something in us changes, and we no longer seek the things that we used to have or desires we used to have before. And so for me, when I went into recovery, it allowed me to focus on my patience. It allowed me to forget about the things that the world wanted me from, which is money, ego, and everything. So now I think that I'm a better doctor. I know that I'm a better doctor because now I serve God.
Right, right. I see Miss Mack, Marlene Mack says, I know that we need to have a testimony for the people that's going to come behind you with the same problem because God is real. Yeah, so Doc, so how can you explain to the people, you guys on the Doug Bass Show with Dr. Jose Luis Flores. If you guys got a question out there, we ain't going to take that long. We're going to just, we just talking. Yes, yes, yes. So, yes. So, Doc. So, how do you draw the correlation with the real life person out there that's not into spirituality, and they saying, "Well, man, all I want is just some, I don't know, narcos, whatever they use out there now. I don't want to know. I don't know nothing about that Jesus talk right now. Mm-hmm. What's more important, the medicine or the spirituality, or you got to work both of them hand in hand?"
And that's a good question. So I'll tell you how it works. The narcos and the alcohol, whatever you're using, becomes your God.
Right.
And it talks to you. And it tells you, without me, you're not going to be okay.
I'm going to put you on the speaker right there because I think a lot of people, man, I ain't talking about nobody's business, but I know what happens I know the streets, you know that already. That's you, Doc. You talking to the people.
Yeah, so it talks to you. It becomes your priority. It gets so much over controlling that it takes priority over your wife. You start yelling at your wife. You start yelling at your kids. You use your rent money. You use whatever. You use food money. And this is the thing is
addiction.
It's addiction. It's a trap. So the devil tells you more, and at the end you end up with more pain. You used up everything, and you have less. You end up more disgruntled, sad. It's a lie, just like the devil. But when you focus on God, God will take you to a place where he tells you, you know what, maybe you should get help. Maybe you should go talk to somebody. Maybe you should talk to your doctor about, hey, doc, I want to get off these meds. What can you do to help me? It's a scary thing. But trust me, that's the right thing, is to ask for help.
Right.
God is there for us to ask for help. And so when you ask for help, the strongest thing a person can do is to ask for help. The weakest thing a person can do is to say, I can do it, because you can't. God says it himself in the Bible. He says it in John 15. He says, aside from me, you can do nothing.
Right.
And so asking for help. So don't get stuck in that cycle. If you're stuck with pain meds, you need certain things, and you know in your heart it's wrong. He says, do not listen to your head, listen to your heart. Then you should do the right thing, and don't be afraid. I'm here as a doctor speaking about addiction. I'm speaking about recovery, about being a doctor, man of God, about my past without any shame, because I no longer have shame, but I have a testimony in Christ Jesus. I have a testimony that I'm alive. I should be dead, but I'm alive, and God is giving me back my license. He's giving me a lot of things, and I'm very grateful. And friends like you, that have always been by my side. Mr. Best has always been there. Even back in my days, he would visit me and says, you got bright, you got brighter things ahead of you. Let's just try to get focused on this and get healthy. And he was very respectful, very kind. Never said like my mother said, just don't do this and do that.
Right.
But always guided me. My mind would tell me, no. I finally went with it, and man, it's the best decision I've ever made.
Yeah, that's beautiful, Doc. And I got to tell you too, man. I said it earlier. Some people was out there now. Listen, man. Maybe I don't. you helped a lot of people, and it might have been some people might have seen it as a negativity, but everybody out there knows what I'm talking about. That was in that world at your detriment. And I was just thinking right now, so a lot of people that's got the pill addiction right now, do it have a negative side effect on the body, like destroying the liver, the kidneys, or the heart? There's a lot of people out there, man, and everybody out there, know that I'm not lying. There's a lot of people addicted to them pills out there. I see it.
Yeah.
I see it out here every day.
Yeah.
What's the negative effect?
So most pills, they have like oxycodone. It's a pure pain pill. It doesn't have Tylenol associated with ibuprofen. When it has ibuprofen,
They mostly narco stuff now.
Yeah.
Is they the same? I know they're a little
so
different.
Norco has Tylenol, and that's toxic to the liver. You develop tolerance, and you'll increase taking it more and more. After a while, you pop 2 every 6 hours. That's toxic level for the liver,
Right.
and you will develop tolerance as part of the pain medication addiction. So even if you took the Tylenol out, the medicine itself is very toxic to the liver. It's toxic to the kidneys. It's toxic to the brain. It slows down respiration. It affects your heart rate. It affects your blood pressure. It can kill you. I'd say this to people: if I am naive to fentanyl, what's in the tip of a pen will kill me.
I see that often just looking out the door.
So that in itself tells you just how toxic the medication is.
Yeah, so Doc, so I'm see if I asked the question right. So if you got addicted, somebody out there, if you guys got a question about something like this, says thank you for okay. So if the person was using, the narco is the one that I see all the time, and they use it for I don't know 5-6 years. Is it gonna have a permanent damage, or once you stop, you cool, or would it affect the liver and the kidney in a way where it might not come back correctly?
So that's the thing I'm saying. If you were to come to me, some docs, I'm just gonna say they're just not as compassionate.
Mm-hmm.
Like when it comes to addiction, but that's why God created me to come to Fresno and try to help and try because I take.
And
them
it's
on
a
all
lot
time.
of people like Dr. Flores, use that holistic approach, common sense. That might be a better word.
Yeah, and so if you come to me, doctor, but you gotta be. I will tell my patients, you're taking a little bit too much. I know you have pain, but this is the consequences it's going to have in your body. Let me check your kidneys. Let me check your liver. Once I see effects of it, then I will let them know, now you're in trouble.
Mm-hmm.
And so we got to stop. And so they say, well, can I change it? Well, yeah, you actually can. You're not quite at that level. The doc will tell you you're not at that level but you're getting closer and closer. When you fall, it's too late. And so don't keep yourself closed in your house. Go see a doctor, especially if you have a concern. Have them run some tests. Have them talk to you about the risks, the benefits.
Okay.
And then go from there before it's too late.
Okay. Yeah, guys, you're on the Doug Best Show talking to medical doctor Jose Luis Flores. If you guys got any more questions out there, Doc, let me just let me scroll through just one more time and just see if somebody else saying something different that I haven't seen earlier. And then, Doc, we just give you the floor to just close it out.
Yeah, no, just say thank you to, when I was starting to get my license back, I wasn't a doctor yet. I was just a drug addiction counselor. Rode a bike for a long time. See, that's when I met you, right?
Well, we was in close at that little barbecue place. What was the name of it? You told the guy this is like a little hidden gem.
It's like a little hidden gem, yeah.
Yeah, I forgot the name of that barbecue place.
Yeah, and I, Mr. Best, I always tell people about that. I met my friend Mr. Best, and God works in wonderful ways because at that point I was riding a bike, and I was borrowing I had like these little clunker cars, and Mr. Best, said, he said, didn't your birthday just, yeah, it's not too long. And Mr. Best just with his generosity just handed me some cash. And with that, I was able to give a down payment on my first car. That was a good car. I have a friend named Natalie. Natalie is,
yeah, Doc, but I owed you that, man. I owe you. A lot of people owe you. And you guys know out there how many people you have, man. And I ain't too proud to say it. I owed you that. And then I gave it to you, but then it was like, you helped me so immensely. I won't say the wrong thing on this thing. But yeah, I gave you the money, but you had helped me so much. A lot of people out there, everybody, Keith Russell, you guys out there looking at me. You guys know in the Boucher. You guys know Miss Mac. A lot of people you helped, man. And so, that was your money.
Well, thank you. Yeah, I tried to help you, but I was just kind of lost, And like I was saying, I had a colleague named Natalie, and she was helping me with. She worked at the addiction clinic, where they do methadone, and she would always like. I would have to call her. Yeah, can you pick me up? Because my cars would break down all the time. She had to pick me up at 5 in the morning. Clinic opened up at 5:30, so she knew my history. So that was kind of my struggle. And then I finally got into this car, a little Honda Accord, and I just served
Good
its
car,
purpose.
man.
It's a good car. My daughter's driving it now, and it's still a good car. I got another Honda Accord, but but the point is, um, for me, it was just a little bit of a downfall, but it was the beginning of a good life.
I think so too, man.
And so everything that that was taken away from me, that I took away from me, I'll own it, was given back to me. But now I've gained Christ. But St. Paul says, I consider it all trash. Everything that I've gained. St. Paul was the highest educated person and Jewish person at that time. He was a governor. He had all kinds of stuff. He lost it all. He says, I consider it a complete loss, and I consider it trash for the sake of gaining Christ Jesus. And that's where I'm at. I'm glad that all that happened. A student of mine who's about to graduate from medical school, he's an Afro-American kid, and he's a really good kid. He's about to, Casey. He's telling, Doc, I just started thinking, I realized you became a doctor twice. Like, and I said, yeah, in Christ Jesus, and so.
Was it hard though, Doc? So you had to go and, man, yeah, guys, you guys know I do taxes. Man, I studied. I'm a bookworm. Some lady, I was at therapy the other day, and she says, "What movies do you like?" And even though I'm from the street and I'm from the mud, I'm really a bookworm. Guys just don't know it. It'd be like today when we doing this show right here. I studied all night last night, so just in case something come up, I'll just know, man. But I was going. So when you had to go back and get the license a second time, you had to take all them tests over.
And that's another interesting. I'll just take 1 minute with that. There's so many tests, and because I was a risk to society, the judge had to sign a paper, and there was, I'm just going to say, Caucasian judge to see a Mexican doctor who had an addiction problem. He take his license away to say, I'm going to sign my name that you can practice medicine. This is a big thing. But it was my testimony. My lawyer says, don't talk about God. I says, oh, no, I have to talk about God. He says, don't do that. I said, I'm sorry. So as I was talking to the judge, I told my whole testimony.
They could tell, man, if it's some bullshit or even though it could be a judge, a lawyer, people could feel if it's sincere.
Yeah, and so I did. And at the end of the whole hearing, she says, I am just completely moved. This man's testimony is truthful, and I see that he's recuperated. And so I'm going to give him sincere. And she gave me the license back. And so it was a struggle. So that was the beginning. Then I still had to take all these tests, pass their psychiatrist, addictionologist, 2 days of testing at UC San Diego. I hadn't been in medicine for so long, but God kept telling me I will be enough. And so I kept teaching Bible studies. I keep teaching my students, and I studied on the side. And God guided me through all that. And
how many hours a day you studying, Dr. Flores?
There's so many years of studying, and because medicine changes so much. They wanted to make sure that I was okay, so they gave me a one-on-one, 1 hour verbal testing. It was just one after another question. There was written testing. There was interactive questions. There was patients that were actually professors. It was such an intense test that, but I knew that God had my back, and so it passed, and everything was good. And so now, I'm a licensed physician again, thanks to God, and I just keep trusting God.
Yeah, keep trusting God and keep the discipline, man. And I think, and then you can tell me if I'm wrong. I think sometimes, man, sometimes my senorita was saying, "Oh, why do you tell the people you're from the street?" I went to see Dr. Poulsen the other day, and this eye doctor, he's just a good doctor, man. He was saying, "How's the street?" And he says, "Or do you just how's the streets?" He says, "Are you associated with a street name or gang?" I said, "Wait, Doc." I said, "Man, I got 2 college degrees. I got multiple businesses. I'm successful." I said, "When I say that I'm from the street, I'm just talking about, I'm a product of the street. Don't mean I'm stupid, man. Don't mean my intelligence is, I got good sense. I'm just saying it like that."
That's right.
And so sometimes, when people hear that, we didn't went through those little trials and tribulations of life, that makes us less. I think it makes us stronger.
Yes.
We went through it, and then, Doc, I think you're saying the same thing right now. You went through and then you accepted the fact that, there's something of power bigger than all of us. Some people are going to call it God. Some people might call it whatever it is. But the whole thing is, once you go through whatever you went through and you're serious about getting up out of there, it's a trajectory so high that you'll never know how high you can go. That's the beauty about me and you sitting here talking. You being a doctor, lost a license. Me being an entrepreneur from the street, lost all that money, baby. A lot of money. More money than if I tell people, they're going to say, that nigga's lying. I ain't lying. It's the truth.
Yeah.
That's yesterday. I lost all that. So now, we growing, and I'm a street guy talking about I love God. Just a doctor saying he loved God. And I know we got some more people out there that love God. And the bottom line, what we trying to say today, you got to have good mental health, spiritual health, and physical health. And that's why we got Dr. Flores. And Doc, I love you for coming, man.
Yes. Thank you.
Now we ain't on with that, man. Hey, he trying to show them. He trying to show them 19s off. Yeah, Doc, you look good, man.
Thank you.
Yeah, Doc, just take us on home, man. Just any way you want. I created the podcast today to tell people, man, you can get a whole bunch of money, and your mind ain't right, and your spirituality ain't right in your own way. You don't have to be like a preacher, and you're not physically healthy. Man, I was gonna say the S word. It's nothing. You got to have good health, physical, spiritual, psychological, and the money gonna come.
Yeah.
You think so, Doc?
Yeah, I think that, again, seek first the kingdom of God and his righteousness, and all things will be added upon you. And people are going to say, well, are you preaching? No, I'm telling you the truth about the word of God and how good it is. And it works. It works.
I wish we had Mike Hughes, man. What Mike at? Go ahead. Though,
yes, it's the key. So here's another. So I'll leave you with some good tips. One, if you're someone that's struggling with addiction, if you're someone that's,
that's your camera. You talking to the people.
Yeah, thank you. And so if you're someone that has addiction and someone who is saying, I have a problem with these medications, and then you're seeing your son, your daughter, your grandkids doing the same thing, I'm telling you this, do something about it. So it'll break the chain. My mom was an alcoholic. This lady could barely speak English. She went to a treatment program that was all English speakers. She finished it. She never drank again. She showed us all the way. Out of the 9 children, there's like 8 of us that had some kind of problem. We're all sober, except one. We're working on one sister. But your example will teach them. Don't be afraid. It's God telling me, let's break this chain. That's the one thing that I will tell you. And the second thing is for your health, see your doctor. Talk to them. If they don't take the time to talk to you, find another one. And be more active with your health. Take your medications, do some exercise, and eat better. And pray.
Yeah, guys, I was just sitting here, just thinking about what Dr. Flores is saying. You guys on the Doug Best Show. And I hope and pray that you guys are going to keep saying over and over, this show is for the people, man. It ain't for to make no money. I got the ability. I understand entrepreneurship. I got 2 college degrees, so I understand economics, I understand accounting, I understand taxes, I understand business, I understand that part. But sometimes, once you get to the point where me and Dr. Flores at, we just want to just share the life experiences and hope that our lives can be like a light for people. And when you're doing a podcast, they say, you got to have a niche. This the niche. Real life stuff. Real life things, And so we talking to Dr. Flores today. Who knows? Next week, I might have George Travis on here that just had a heart attack. And Doc, they went inside his heart, and I guess the main artery was 99% blocked.
Oh, that's dangerous,
Yeah. So he stayed in the hospital, I don't know, 8, 9 days. I went up there and seen him. He said, man, Doug, I thought I was going to die. Don't tell nobody. I got my camera out. Yeah, guys, so, Dr. Flores, I love you for coming, being on the show, man. It's always a joy and always an honor, man. And then just tell us, there's a lot of people, I didn't go through what everybody said on this, too much. But, man, maybe just come back again. I'm telling you guys, I said yesterday I did a little podcast. How I need everybody out there, just go to YouTube and just subscribe. Let's make the show a big show. And, we're going to get entertainers and politicians. I'm going to get all them different people on there. But right now, we starting where we at and just going to keep it real 100%. Dr. Jose Flores. Dr. Jose Flores, we really, really appreciate you. And everybody out there that's been tuning in,
Thank you.
y'all go to YouTube. Doc, I love you for this, man.
Love you too, man.
And then I know all the people out there that you got something up out of it. I was watching Joe Rogan. He stayed on the airways for 3-4 hours. And he just sold a show for $100 million. But we ain't in it for the money. We in it to share with the people. I love everybody. Booyah, baby! Dr. Flores. We love you guys out there. Thanks, Doc. I'll see you guys soon.
See you guys.